During the year of 2020, humanity has faced an extraordinary situation against an invisible enemy. Health professionals all around the world and the WHO have responded to this with an outstanding efficiency. Here is a recognition to them through the chronology of their actions to control COVID-19. December 31st, WHO's Epidemic Intelligence from Open Sources platform picked up a media report on PROMED, a program of the International Society for Infectious Diseases, about the cluster of cases of pneumonia of unknown case in Wuhan. Several health authorities from around the world contacted WHO seeking additional information. January 1st to 5th, WHO requested information on the reported cluster of atypical pneumonia cases in Wuhan from the Chinese authorities. WHO tweeted that there was a cluster of pneumonia cases with no deaths in Wuhan, Hubei Province, People's Republic of China, and that investigations to identify the cause were underway. January 10 to 15th, the Global Coordination Mechanism for Research and Development to Prevent and Respond to Epidemics held its first teleconference of the novel coronavirus, as did the Scientific Advisory Group of the Research and Development Blueprint, a global strategy and preparedness plan that allows the rapid activation of research and development activities during epidemics. WHO published a comprehensive package of guidance documents for countries covering topics related to the management of an outbreak of a new disease. The Ministry of Public Health in Thailand reported an imported case of lab-confirmed novel coronavirus from Wuhan, the first recorded case outside of the People's Republic of China. January 16 to 20th, the Pan American Health Organization, WHO Regional Office for the Americas, issued its first epidemiological alert on the novel coronavirus. The alert included recommendations covering international travelers, infection prevention and control measures, and laboratory testing. The WHO Western Pacific Regional Office tweeted that, according to the latest information received and WHO analysis, there was evidence of limited human-to-human transmission. January 21st to 25th, WHO conducted the first mission to Wuhan and met with public health officials to learn about the response to the clusters of cases of novel coronavirus. WHO and WPRO tweeted that it was now very clear from the latest information that there was at least some human-to-human transmission, and that infections among healthcare workers strengthened the evidence for this. France informed WHO of 3 cases of novel coronavirus, all of whom had traveled from Wuhan. These were the first confirmed cases in the WHO European region. January 26th to 31st. WHO released its first free online course on the novel coronavirus on its open WHO learning platform. The United Arab Emirates reported the first cases in the WHO Eastern Mediterranean region. WHO's Regional Director for Africa sent out a guidance note to all countries in the region emphasizing the importance of readiness and early detection of cases. February 1st to 5th. WHO finalized its strategic preparedness and response plan, centered on improving capacity to detect, prepare, and respond to the outbreak. The WHO Director General asked the UN Secretary General to activate the UN Crisis Management Policy, which held its first meeting on 11th of February. WHO's headquarters began holding daily media briefings on the novel coronavirus. February 6th to 15th. WHO announced that the disease caused by the novel coronavirus would be named COVID-19. WHO convened a global research and innovation forum on the novel coronavirus, attended in person by more than 300 experts and funders from 48 countries, with a further 150 joining online. February 16th to 28th. A mission to China stressed that, to reduce COVID-19 illness and death, Near-term readiness planning must embrace the large-scale implementation of high-quality, non-pharmaceutical public health measures, such as case detection and isolation, contact tracing and monitoring, quarantining, and community engagement. March 1st to 15th. WHO published the Global Research Roadmap for the novel coronavirus developed by the working groups for the Research Forum. Deeply concerned both by alarming levels of spread and severity and by the alarming levels of inaction, WHO made the assessment that COVID-19 should be characterized as a pandemic. March 16th to 31st. WHO launched the COVID-19 Partners Platform as an enabling tool for all countries, implementing partners, donors, and contributors to collaborate in the global COVID-19 response. The UN Global Humanitarian Response Plan was launched by the WHO Director General, UN Secretary General, UN Under-Secretary General for Humanitarian Affairs, and UNICEF Executive Director. Aside from the G20, WHO joined with UNESCO and other partners to launch the Global Education Coalition to facilitate inclusive learning opportunities for children and youth during this period of sudden and unprecedented educational disruption. April the 1st to 15th. WHO reported on evidence of transmission from symptomatic, presymptomatic, and asymptomatic people infected with COVID-19, noting that transmission from a presymptomatic case can occur before symptom onset. WHO issued updated guidance on masks, including a new section on advice to decision makers on mask use by healthy people in communities. April 16th to 30th. WHO issued guidance on considerations in adjusting public health and social measures, such as large-scale movement restrictions, commonly referred to as lockdowns. May 2020. The Director General addressed leaders from 40 countries from all over the world at a COVID-19 Global Response International Pledging event hosted by the European Commission. The Director General highlighted that the ACT Accelerator represented a unique commitment to work together at record speed to develop essential tools to prevent, detect, and treat COVID-19. He went on to emphasize that the ultimate measure of success would be how equally these tools were distributed as part of ensuring health for all. June 2020. WHO published updated guidance on the use of masks for the control of COVID-19, which provided updated advice on who should wear a mask, when it should be worn, and what it should be made of. WHO's first infodemiology conference began as part of the organization's work on new evidence-based measures and practices to prevent, detect, and respond to mis- and disinformation. July and August 2020. The COVAX facility, a mechanism designed to guarantee rapid, fair, and equitable access to COVID-19 vaccines worldwide, secured engagement from more than 150 countries, representing over 60% of the world's population. 75 countries have expressed interest in financing the vaccines from their own public finance budgets and partnering up with 90 lower-income countries that could be supported through the COVAX Advanced Market Commitment. WHO published its first indicative survey on the impact of COVID-19 on health systems based on 150 countries' reports, with 90% experiencing disruption. September 2020. The Review Committee of the Functioning of the International Health Regulations during COVID-19 response began its work to evaluate the functioning of the IHR during the pandemic and recommend any changes it believes are necessary. The review committee was convened by the Director General in line with the landmark resolution adopted at the 73rd World Health Assembly.